that's a nice old barn.
You know, we love them. There you are.
It's been a crazy day. Turn my phone off so it don't start ringing in the middle. And it just started ringing, and I'm not going to answer it.
Can you see the barn in the background?
Yes. I couldn't see the stuff down below, but I could see the rafters and stuff, and it looks awesome.
Yeah. We're still under construction, but it's, but we're happy with where it is so far.
It looks wonderful. I wished I had one like that. It has been absolutely crazy.
Same here. It's been insane. Okay. This is so much fun, though. It's all good. We'll collaborate on something else.
Oh,
okay, bye.
Absolutely.
Okay, all right, bye. This is great.
I just asked in case you said something that you went, "Oh, I shouldn't have said that." Hello, everyone. I am the Doctor of Disaster, Mark Warnick. I have a Ph.D. in public safety, and I'm recognized as a subject matter expert for not one, but two universities. Welcome to the Doctor of Disaster, and we're here with Jennifer Carlson, Dr. Jennifer Carlson. Please don't let me forget that. We went through the doctoral program pretty much together.
Yeah.
And had each other in a couple of classes. And we've stayed in contact, not as good as we should have, mainly my fault. But anyway.
Mine too.
Jen, Dr. Jen, what do you prefer to be called?
Oh, people call me Dr. Jen, Dr. Carlson. I usually ends up being Dr. Jen. So.
Okay, Dr. Jen. So, how about you give us a little bit of your background?
So, like you said, we graduated from the program back in 2015, and I've been in emergency management for over 20 years. I've deployed all over the country, many deployments, Hurricane Katrina, the Boston Marathon bombing here in our state. And just, I love what we do, very passionate about the field. And I can't believe this is going on right now with COVID-19. But hey, here we are. So I don't want to say too much. I also have a clinical social work background. And so I do that, during the day, as much as I can. So, yeah.
Nice. So, you've deployed and you know what we're facing right now.
Yep.
What are your thoughts on what the media is reporting as a food shortage?
So I think, definitely meats, both pork and, pork versus beef, depending on the area that you live in. And I think they're leading for us to eat more in terms of plant-based food, like tofu and things like that might not normally be appealing. But I think the shortages are going to go on for as long as this goes on for. I think that it really is lent to in great part due to staffing. There's a lot of people out there that have either, been scared to work, or if they're not scared, they might be sick, or they might have a family member or a spouse that's sick, and so all of that's related in terms of food shortages. And so I think it will get better as things go on, because we can't stay hunkered down forever as much as we know it's important right now. And we have all of these other shortages that we're dealing with, so it's not just food. We're dealing with the staffing that also impacts the food and impacts everything, but we're dealing with drug shortages. We're dealing with PPE, personal protective equipment shortages, things like emergency syringes we're short on. So just looking at my notes, because I brought a few notes, but FDA claims, and I'm not going to pass judgment on anybody, but the FDA claims that they're working hard to secure the global supply chain. I couldn't tell you exactly what they're doing, but I know that they claim that they are working on that. They're working on also securing more medical devices, even veterinary medicines. So all of that is closely surrounding the food issue. So long answer to a short question.
Well, now here, you know me, I'm a mitigation thinker.
Yep.
What mitigation measures do you think might work to help alleviate some of these shortages? Now, remember the food shortages are not on the farmer's end and they're not on the store's end, they're
True.
on the processing point. So what
It's
can we
true.
do to mitigate some of that?
Well, I think if we're talking about mitigation first at home, I think the best thing that we can do is look at, supplies that we have, whether it's canned or processed food. Sorry, that's my generator in the background. Um, we have a generator going out to our greenhouse, so we've got it like plugged in nearby. Um, but canned or processed foods are really important when you're thinking about mitigation on the home front. But in terms of mitigation on a wider scale, I think preparing in advance by having good emergency plans would help that. Really looking at what we're short now and not allowing that to happen in any way possible in the future.
And
Um,
you
you,
know,
you look
one of
at some of the plans that FEMA has, and yet some businesses don't have those plans, and it doesn't make any sense.
that's true. Well, if you look at the situation we're in right now, one of the issues that we continue to have are the workers aren't there. And why can't we, and I'm assuming you butchered before because you're kind of a hobby farmer, why can't we take unemployed people and give them a day's training and not on how to cut the meat exactly, but the normal cuts, full chickens or hamburger. It doesn't take much to bone beef and turn it into hamburger. Maybe we take hogs and we get hams. What's your thoughts on
Yes.
that?
I think those are smart ideas, things to look at, definitely. I think the more we can plan in advance for that, I mean, right now we're in it, but the more we can plan in advance for that makes sense. I don't understand why there aren't mitigation plans already in existence that address some of these things, because we did have an epidemic before, we had a pandemic 15 years ago. So what happens between now and then where we don't have this in place, but hey, here we are.
Yeah, well, you worked that epidemic too, didn't you?
Yep. Yep. We were working on pandemic planning out in Westfield, Massachusetts, and with the Red Cross. And it was really upsetting that, they talk about it now, looking back then and saying what a bad job everybody did. Not us in emergency management, but like, the administration in general. Um, and I gotta say that as horrible as it may have been, no pandemic is ever going to be perfect. The only way to truly mitigate is to plan, and to write
Absolutely.
it down, best practices, applying everything.
Well,
So
and
yeah,
we're in a world that thinks about the minute rather than preparing for the worst.
it's true.
And, you know, you and I both know this, but preparedness starts at home. We can't rely on the federal government, and the states can't rely on the federal government because every disaster is local. Wouldn't you
Yeah,
agree
no,
with that?
definitely, always. I say
Uh,
that all the time. Every disaster is local. It starts at home.
and what drives me nuts as an emergency manager is to hear people say, well, the state's not doing this and FEMA's not doing that. Don't they bear some of that responsibility to prepare
Yeah,
themselves? It just
I
drives me.
really, yeah, I agree. It's frustrating to watch it and to see what's happening. Um, I think they were a lot worse off years ago, but if you really quantify and look at where we are now, where we were then, what really is different?
Yeah.
It's we're still
Well,
having problems. you know?
and the last data I saw, it was like, and I could be wrong, but I thought it said like 39% of people prepare. That leaves
Yeah,
basically 60% who aren't
yeah,
prepared that everyone else is going to have to take care of.
yep,
Uh, let's have some personal responsibility. I know and this is for people that might watch this who have a limited income. When my wife and I were living off 500 and some dollars, um, every week, no matter what, we bought a little extra something. If we
yeah.
couldn't afford it that week, we'd buy some extra canned goods. If we
Oh,
could
yeah,
afford it, we'd buy meat and put it in the freezer
yep,
or canned meat.
yeah.
So, you know, it's just crazy that people expect to be taken care of
I
when
know it.
there should be some responsibility, at least in my opinion.
I agree. I think people really need to think ahead, and there are a lot of people that have the money to think ahead and they don't. They don't prioritize it.
Well,
Should almost be required.
they think they can buy their way out of it.
Yeah, right.
Yeah, you know what I'm
It's
talking about.
crazy.
So
It's
let
crazy.
me ask you this. What's your opinion on shortages in emergency management, fire, EMS, doctors, and uh, basically the first responders that we've seen responsible in this pandemic?
I think, my opinion is that on the policing side, from what I've seen anyway, from my view, they've done a fantastic job on the policing side. In terms of the medical side, I think that we should have been more prepared with mental health because I think what happened was we've even seen some suicides now with doctors. And I think that they were prepared in a lot of respects, maybe not so much with ventilators, but definitely in a lot of respects and not in mental health at all because there's always a stigma around that and nobody ever wants to talk about mental health. But now they're seeing that people have committed suicide, educated physicians, doctors, because they just can't handle this. And I think they need to do some planning around that in terms of mitigation for the future. And then in terms of EMT, I feel like they've done, at least in Massachusetts around here, they've done a really great job. I don't know what more they could have done except maybe, beef up their staffing, which I think you
Right.
see everywhere.
But there's
The
shortages.
policing, yeah,
Shortage.
the policing has been excellent though. We've
Well,
seen deaths though. That's the thing. So PPE always.
well, we there's been a shortage of uh, paramedics and firefighters since, well, it was first identified in 2010. So we're 10 years later, and we haven't done anything to mitigate that.
Yeah,
And my concern is that because of the mental health aspect, we will lose a bunch of them who say it's not worth it anymore. I'm done.
yeah.
And because we're on lockdown, we're not training replacements right now. So we're going to have a shortage that's 9 months to a year later.
Yep. Yeah. No, I agree. Well, I think that training is one of the most important things, whether it's EMTs or policing, but even the private businesses like Walmart. Before somebody walks on a job, because I'll just say, when I walk on my job, there's 3 online trainings you have to do and put on full PPE before you even walk in the door. And these 3 online trainings that talk about PPE and talk about what you're supposed to do inside, I think mitigate a lot of the problems we're having. So, for example, 20 minutes down the road, we have the Worcester, Massachusetts Walmart, and they were closed yesterday, the day before, because out of just under 400 employees, 81 employees tested positive. And so I think it's the largest, highest number of employee tested in a Walmart in the country, I think. And so it's completely shut down. It's this gigantic super Walmart, biggest super Walmart I've ever seen. And I can't help but wonder if they had those trainings, when they walked in the door, and they were stricter about the PPE walking in the door, and having managers and supervisors that were ensuring that people were following what was going on, those 81 people would not have gotten infected or infected other people who walked in the store. Who knows how many?
Right.
And who knows how many are going to die now of the 81? We don't know. So it's just interesting, and the other supermarkets too, same thing. Why are there not trainings online when you walk in the door? And even if it's not online, even if it's just in person, to mitigate, that kind of stuff.
Do you think that because we're in public safety, we understand that better than many of the retail outlets?
I think we do. I think we do. I think any human service agency too understands better, because I know in Massachusetts, all the human service agencies have requirements with the state emergency management agency to do X, Y, and Z for crew planning. So they have those continuity of operations plans. And even though there are some groups at like Walmarts and things like that, it's not as detailed, it's not as finite in terms of people. Because a human service agency is more people oriented, and even though there's people at a grocery store, they're more about the stuff, in my opinion. you know,
Let me
um,
ask you this. Does public safety not grab the ball and run with it when opportunities come up? So, as an example, perhaps we should have been sending to help mitigate, sending paramedics, EMTs, and firefighters to the stores and said, let me give you a training on how this works.
yes, yep,
I,
yeah.
I
Because what if the managers don't know what to do? Like
exactly. I
my
mean,
agency, like they asked me now, and I know a lot in some things because I'm emergency management, whatever, for all these years. But that was all they had, and that's not right. They should have somebody who's specific to public health or specific to CDC, guidelines and things every day, who's doing this as an SME, the subject matter expert, to really help them. That's why I think these trainings developed in advance, whether it's online or in person, that are developed by the professionals, the experts, are important, because we know a lot, right, Mark? But we're not the health experts, you know?
well,
Like,
and we know enough that we know how things are supposed to be done. And
yep,
when they're not, we see huge red flags and we start to say something and people go, you're not an expert in that.
yeah,
Really? Really?
yeah,
It's frustrating in a lot of ways. Um, yeah, I could go so many places with this, but
yep,
I know that you need to go soon, so I'm
yeah,
giving you the an opportunity I give to every one of my interviewees.
yep.
I am going to allow you to tell a Mark Warnick story. Anything that sticks in your mind.
Oh, Mark Warnick story. Gosh, I just remember that, we worked so hard in our PhD and we're trying to get through all of the hoops. Um, you know, but I mean, you know,
Yeah, I'm lucky with you. Many of my students have plenty of stories.
yeah, you know. So
Now,
yeah.
I do want to mention that uh, Dr. Jen also teaches um, at the college level, university level,
Yeah.
um, including, go ahead.
Oh, so I've taught at Embry-Riddle Aeronautical University, Eastern Kentucky University, the Massachusetts Maritime Academy. I'm wearing their shirt today. Um, and just I love teaching. I'm looking at doing some facilitation with Anna Maria College soon, and so I'm excited about that. So yeah, I'm just out there in it more than anything, not for the money, but for the passion of it. Like we've talked before, you
Yeah,
know, you
but
know,
just so the viewers know, we both have a passion for emergency management and public safety. Most of the time, we'd rather not worry about the pay and save lives
yep,
than to actually get paid for something, which sounds crazy, but that's us. And
yep,
by the same token, we are both hobby farmers.
Yes.
And
Yep.
gee, I wonder why.
Which reminds me, if anybody hasn't planted their little garden, which would back them up, even if you don't have the ability to do a big garden, a small garden that would back you up should you not have access to food, that's a good idea too.
Well, and yesterday in my video that I released, I said, what about canned goods? We aren't going to starve. There's enough canned goods on the shelf.
Oh yeah. Yep,
So
canned goods and frozen foods and all that,
yeah,
because if you have a generator, your freezer will go on, you
exactly.
know? Yep.
Now you're giving away some of our secrets, how we survive
Yep.
everything.
Yep.
Anyway, Dr. Jim, thank you so much.
Thank you so
Um,
much.
Go ahead and promote your YouTube channel as well.
Oh yeah, so I have a small business LLC which has disaster planning as one of its two primary businesses, and so I like to share a lot of information. So my next video that's coming out is going to be on the education of a nation or surrounding this, what we've been talking about today and some other things related to COVID-19 and just pandemics in general. But I love that it's right now it's just to be inspirational and empowering to talk about the subjects that we love, Dr. Mark. That's pretty much what it's about. But I do workshops out in the community and here at our farm, and
The
so
problem
yeah,
we have is we have so many similar likes that when we get on the phone together, it
we talk a lot.
takes us 2 hours to get off. Yeah,
I know, I know. It's good to have a time limit for us, right?
yeah, but it's great fun, and we say what's on our mind, which is something that's really central to public safety. Say what you mean. Don't beat around the bush because we've
Yep,
got
mean
work
what you
to do.
say.
Yep,
Yep,
yep. Dr. Jim,
absolutely.
thank you so much.
Thank you. I'll
And
see you soon. Talk to you soon.
absolutely, and I absolutely enjoyed this. Thank you,
Me
man.
too. All right, I'll see you later.
Bye bye.
Don't forget to get your copy of the Doctor of Disasters book, Emergency Incident Management Systems, at Amazon.com. This book is the go-to on managing disasters and on the Instant Command System. The Doctor of Disaster is a wholly owned subsidiary of Warnick & Associates Incorporated.